Good morning. My name's Olivia. I'm also known as Olivia K on Facebook, Ollie K on Instagram, and WarmYam9800 on Reddit. So I talk about nursing related materials. That includes NCLEX for first or second or third attempt takers. I also go over reality TV shows because nursing is a lot and you gotta decompress sometimes. And I also react to movies or documentaries or opinion pieces of certain issues going on in the world. So I had a script ready for left heart failure, but I'm glad to go with what I know and do my best I can. I'm upset because I thought I had the script ready. I guess not. So I got to make sure I know what I'm talking about, don't I? Okay, so today's left and right hearted failure. So I know most people do already have the knowledge of it, but it's just important to make the distinction because, again, with NGN style questions, sometimes it's easy to miss which type of heart failure they're talking about, and if they don't completely talk about all the symptoms, and it's easy to get confused. So I just want to be able to point out keywords or key phrases that you'll be able to be like, okay, I know the difference, and it'll be easy to answer the question. Oh my God, my ears a little weird now. I'm sorry about that. Okay, so heart failure, basically when the blood backs up on either side, and basically the heart's not pumping effectively. So it has different manifestations depending on what side of the heart it's being affected. So when we're talking about left heart failure, now back up to the lungs. So when we think of left-hearted, I'm going to open the door a little bit. When we think of left-hearted failure, think about this. Lungs start with the letter L, correct? Yes. Then left starts with the letter L, correct? It does. So the manifestations you're going to see is shortness of breath, especially when you're lying down. Then you can cough. And remember how I asked you guys about the pink frothy sputum? That's going to manifest from left-hearted failure, fatigue, and crackles of the lungs. So you'll mostly see this with hypertension, coronary artery disease, and possibly MI. Because, like I said, think left lungs. Okay, sorry about the plane, or rather the helicopter. Now, right-hearted side, it's more systemic. So this is the whole body, okay? So I don't have a memory trick for that, but when we're thinking right is the whole body, the systemic circulation. That's where the blood would back up to. So here are your symptoms. You have swelling the legs and the ankles, so you'll see a patient with edema, okay? Pitting edema may be traced depending on the severity of the fluids that's accumulating. Abdominal swelling, ascites. So even with ascites too, you can also see the ALT-AST, which I have mentioned before. That's your liver function in labs. It's going to be off the roof, sky, enlarged liver, and then the GVD. So I've mentioned this before. So you have your vein here. It's going to pop. It's going to be all this thing, distended, and you can visibly see it. So this also will stem from untreated left-hearted failure. Then pulmonary hypertension, COPD. Oh, so I do have a memory trick at all. So we're thinking, right, that's the rest of the body. Rest of, so R, right? Right starts with the letter R. So maybe that will help, okay? So, typically, the treatment for heart failure would be beta blockers, for example, sorry, you're looking at my mess. So for example, atenolol, metoprolol, right? So that's going to lessen the load on the heart. Then your Lasix. So I know primarily would be your say spironolactone, and depending on your pulmonary function, right? ACE inhibitors for left heart treatment. So lisinopril, losartan, valsartan. So again, reducing workload, beta blocker, slowing the heart, metoprolol, carvedilol, diuretics. So like I was just saying, Lasix or furosemide, spirlactolone to keep the potassium. So again, you have to look at your electrolytes. Pay attention to that. Oxygen with left heart failure only, because again, this is affecting the lungs and the person will have shortness of breath, or they might need the ICD, so implantable defibrillation. So with right heart failure, you want to treat the cause, but I know it's mostly diuretics and salt reduction, daily weights, because you want to reduce the fluid, and these people will not be breathing and they're not going to have a good time, if that makes sense. And again, right heart failure, if we can get back to what we're talking about, right? Right heart failure can be untreated left heart failure. That's what it mainly can result to if that left heart failure isn't treated. And coronary artery disease, maybe hypertension. So get those patients on the hypertensive beds, and that's about it. So that's really what it boils down to for the treatments, and hopefully that helps. So, I mean, yes, again, you can figure out the distinction between the two, but with NGN style questions, they make you and force you to think, because questions are not just straight up, and that's how it is for NCLEX. So it's just important to find the key things. So with left, you're thinking pulmonary, lungs only. With the right side, swelling, and it's affecting the rest of the body. So I hope that makes sense, and I hope that helps. Anyways, that's that, and I will leave some links and sources. If you didn't get much out of it, I hope you did, but I will leave some sources for you. And it's beautiful out today, 70-something degrees, and sadly I gotta get to work. Anyways, have a good day and take care. Bye.